Greetings and welcome. I am Dr. Jeffrey Sterling, the Surgeon General for the Alpha Phi Alpha Fraternity Incorporated. And on behalf of our beloved fraternity and the Leukemia and Lymphoma Society, I want to welcome you to this pretty important conversation. Along with a fantastic panel that we have assembled here, we're going to be looking to empower you to be better stewards of your own healthcare when it comes to issues of cancer. And I want to begin by congratulating you literally for joining this conversation because you may or may not be aware of this, but along with heart disease, cancer is one of the top two causes of death, both in the general population and for the African American community. And I bring that up in the context such that if you're interested in a long duration of life and a high quality for that duration, you really need to know how to avoid the most common causes of death. So to that end, we acknowledge March as the Multiple Myeloma Awareness Month, and we want to take this advantage of this opportunity to focus on cancer symptom awareness, treatment, and particularly survivorship within the African American community so that you can have tips and tools to empower you, your family, and those with whom you have close proximity and you care for. So with that in mind, I want to just take advantage of this opportunity to introduce this fantastic panel. And I hope that they'll introduce themselves a little bit more than I'll be able to because there's no way to do them justice. We have Dr. Terrell Corrick, who is an oncologist specializing in multiple myeloma. We also have a blood cancer patient here, Brian Kelly, who will be sharing personal experiences with cancer treatment and survivorship. And I trust that some of you in the audience will find this very heartfelt and relatable. And hopefully, for those of us that inevitably will develop this, some of the words will resonate as we have our own journeys towards surviving cancer. We also have a community leader here, Rodney Jones, who represents a very important nonprofit advocacy organization that focuses on community outreach and support. One of the things that you'll need to know early and often is if this does befall you or your family, how to reach out and to get access to important community resources that will help you on your journey. So we've assembled a wonderful panel, and let's set the stage. Let's begin this conversation by discussing the importance of cancer awareness in the Black community. So with that said, Brother Rodney Jones, the floor is yours. Welcome, and let's hear what you have to tell us.
Thank you so much, Dr. Sterling, and thank you for having us. Thank you for providing this platform. I appreciate your leadership in this effort. I'm Rodney Jones. I'm Community Outreach Leader for the Leukemia and Lymphoma Society. I implement education programs for patients and their families, and I support the Leukemia and Lymphoma Society's mission to improve the lives of patients and their families, and we find a cure for blood cancers. And I just want to comment real briefly about the disparities in blood cancer diagnosis and treatment among the Black community. It's really critical for us to address disparities about blood cancer, cancer diagnosis, and treatment that continue to affect the Black community. Unfortunately, African Americans are more likely to be diagnosed with myeloma at later stages when treatment options are limited. But with awareness and education, we can really change this. And so the role of community organizations like the Leukemia and Lymphoma Society help us to increase awareness and increase education. March is Myeloma Awareness Month. It's really a month that's been set aside to just raise awareness about the signs, symptoms, and treatment of myeloma. And the Leukemia and Lymphoma Society, we are at the forefront in the fight against myeloma. And we want to raise awareness about the signs, symptoms, and treatment and connect you to resources that are available. The Leukemia and Lymphoma Society has a number of resources that are available, everything from expert information from our Information Resource Center to financial resources to peer-to-peer support in case you or a loved one has been diagnosed. And we're working to increase this awareness and education on platforms like this so that individuals who hadn't heard of myeloma can understand it and, advocate for themselves. Some key statistics that I'd like to share are that African Americans are at twice the likelihood as white Americans of being diagnosed with myeloma. Recent studies have shown that myeloma is the ninth most commonly diagnosed cancer among Black people. African Americans account for 22% of yearly multiple myeloma cases, and fewer are getting screened or participate in clinical trials. This is something we need to change. And fortunately for us, we've got platforms like this where we've joined forces with the Alpha Phi Alpha fraternity and LLS have they've formed a partnership. Leukemia and Lymphoma Society's mission is to cure all blood cancers and improve the quality of life for patients and their families. And the Alpha Phi Alpha Fraternity Incorporated is teaming up with us in designated cities. Many Alpha Phi Alpha chapters are already serving the community, and they're also partnering with LLS to connect the community with information, education, resources, and raising awareness about myeloma and its effect on our community. So I want to encourage everyone to listen tonight, listen to your bodies, advocate for your health, and educate yourself. Thank you, Dr. Sterling, for this opportunity.
That's fantastic. I'm not going to let you off the hook that quick because as we have our oncologists coming up, I want to stay with you for a second. The work you do is so critically important. But before it ever gets to the point of needing to understand medical signs and symptoms, I just wanted to ask you a question about social determinants of health and what people can look for in their existence that might put them at a higher degree of risk for cancers in general and for myeloma in particular. Would you be so kind as to share something along those lines with us?
Absolutely. I'm actually a biblical believer, and I'm a proud member of the House of Alpha. And I will say that there's an old adage that says knowledge is power, but the Bible said that my people perish for the lack of knowledge. And so the more you know, I think the better off you are. And so platforms just like this, the ones that you're providing for us, Dr. Sterling, really, really help us to connect ourselves to new information. I really didn't know very much about blood cancers until I began my relationship with LLS in I think 2023. And the more you know, the better. This is something that we don't often talk about, which is blood cancers. We often talk about diabetes, we talk about obesity, we talk about stroke, we talk about gout, but we rarely talk about blood cancers. So I think connecting yourself to that information is critical.
I love that. And, one of the most common phrases that I use to move off of what you said is knowledge is health. And in terms of a disparity, I just want the audience to appreciate that if you don't know about it, you can't address it. And you're going to be hearing some things that present as clinical symptoms. And I know that that's going to be a part of the upcoming conversations, particularly with Dr. Corey. But keep in mind, folks, we want you to be empowered. We want you to be educated. We want you to be informed because it's actually a good thing. We tend to run and hide and hope that diseases go away. That's not how this works. The sooner you know, the sooner you are aware, the sooner you get diagnosed, the better opportunities you're going to have for a full, complete, and meaningful recovery. So once again, thank you, Brother Jones, and let's continue the conversation with Dr. Corrick, who will be giving us insight. He's actually going to help us understand some of the symptoms if and when they present and what some of the treatment options are. So welcome, Dr. Corrick. The floor is yours.
Thank you, Dr. Sterling. I hope everybody can hear me. My name is Dr. Coring, one of the hematology oncology fellow physicians training at Duke to be a multiple myeloma expert. And so it brings me great pleasure to have these conversations. As a member of the African American community, I'm very passionate about sharing this knowledge to our fellow community members to draw awareness, to help close the disparity gap that we're talking about. And so before I get into the conversation, I just want to say thank you to the Alpha Phi Alpha community members, as well as LLS, for giving me this opportunity to share this important information, especially it being multiple myeloma month. And so before we talk about the signs and symptoms of blood cancers, let's talk about blood cancers within itself as an entity. You see, blood cancers are considered cancers that affect the blood. And we label blood cancers as the big three. Typically, leukemia, lymphoma, and multiple myeloma are the three cancers that we use to refer collectively as blood cancers. These cancers collectively cause about 10% of the new cancer cases. So these cancers should not be ignored simply because they are popular. In fact, multiple myeloma is the most common blood cancer that affects the African American community. And so let's define multiple myeloma and the other blood cancers before we talk about the symptoms. And so when we talk about cancer, we're saying that somebody or a patient have uncontrolled copying of the cells. We call that cloning. And when we talk about leukemia, it's uncontrolled copying of the white blood cells. Lymphoma is uncontrolled copying of cells within the lymphatic system. And multiple myeloma is multiple or uncontrolled copying of the cells in the bone marrow Specifically, these cells are called plasma cells. So uncontrolled copying of the plasma cells lead to multiple myeloma. And the reason why this is important to understand is because these cloning of the plasma cells or uncontrolled copying of the plasma cells, as we just learned, takes place in the bone marrow. The most common presentation or the most common symptoms of multiple myeloma is back pain. So it's very important to understand where the disease takes place so we can understand the symptoms. And so back pain being the most common symptom, as an African American, understanding that multiple myeloma happens twice as much when we compare to other ethnicities, it's twice as common within our race. So we should be aware of the signs and symptoms. And so multiple myeloma, the most common sign and symptom is back pain, also anemia. And a sign and symptom of anemia is headache, dizziness, also feeling fatigue. And when we consider other blood cancers like lymphoma, we should be also aware of something called lymphadenopathy, which basically is a fancy way of saying swelling of the lymph nodes, particularly lymph nodes around the neck, underneath the arm, and the groin area. Also, signs and symptoms of lymphoma can be night sweats, uh, fevers, unexplained cough, as well as frequent infections. And when we talk about leukemia, the most common sign and symptom of leukemia is weight loss, unexplained fevers, night sweats, as well. And we should be very, very aware of these, again, symptoms so we could be aware of our own health in order to get screened. And we're going to talk about screening in just a second. Also, I would like to share with you is when we talk about multiple myeloma and the disparities, it takes about 6 months as long to diagnose multiple myeloma when we talk about African American patients. Therefore, what I'm saying is we are diagnosed 6 months later than the traditional population, mainly Caucasian Americans. And one of the reasons why is because we ignore these signs and symptoms. I'm going to give you a quick story. So one of the common signs and symptoms of multiple myeloma is back pain. I had a patient who presented to the emergency department with back pain, specifically in the lower back. This patient thought they just basically pulled a muscle, so essentially was diagnosed with a muscle strain within the back, was prescribed ibuprofen and told to go home, and the pain should subside eventually. However, a few months later, in fact, 6 to 7 months later, the pain persisted. The patient went back to the emergency department and was diagnosed with a pathological fracture along the spine. And that therefore was essentially diagnosed with multiple myeloma after fixing the fracture with a biopsy. And if this patient were to be diagnosed 6 months earlier when she first presented, instead of giving ibuprofen, actually started treatment for the multiple myeloma, then that would prevent a late stage diagnosis. In fact, diagnosing these cancers in its earlier stage helps decrease the disparity and actually prolong life and decrease mortality. So what I'm saying is it's very important to pay attention to the signs and symptoms to get the diagnosis at its earliest stage in order to have best mortality. Now let's talk about treatment really briefly. When getting diagnosed with these blood cancers, the cornerstone treatment is chemotherapy. We also use immunotherapy such as CAR T cell therapy and also stem cell transplantation. Clinical trials is also an important treatment for blood cancers. And the reason I bring clinical trials up into our discussion is because there is a really, really disparate representation when we talk about clinical trials in the African American community. You see, there's a major misrepresentation of clinical trial participation amongst the African American community, and we understand why. It's because of historical events, such as the Tuskegee syphilis studies, and therefore there's deep-seated mistrust in the medical community, leading to fears of exploitation because of historic events. But I'm here to tell you, the consent process is more robust. We have IRBs in place to prevent any mistrust. Things are very transparent nowadays, and clinical trials is some cornerstone treatment for some of these rare blood cancers, and therefore becomes paramount that we get involved in clinical trials. It could be life-saving. So much so that we researched that when being treated and having equal access to treatment, just as the rest of the population, African Americans actually do even better than Caucasian Americans when being treated and started with timely novel treatment for these blood cancers. Just as statistics for you to understand, multiple myeloma is traditionally a cancer that caused great disparity amongst African Americans. But there was a study that suggests that when African American patients get treated timely with the appropriate therapy, they do just as well with the disease. And I want to end by discussing screening and prevention. You see, there is such a disparity with these blood cancers simply because we lack awareness. And lacking awareness, therefore, we lack screening. And understanding the signs and symptoms of these cancers can alert you to become your own self advocate, to advocate for screening for yourself. For example, if you're having unexplained back pain, if you're having signs and symptoms of anemia, dizziness, headache, fatigue, especially if you have a family history that suggests multiple myeloma, you should bring these symptoms to your primary care provider to ask to be screened for this disease. The same with lymphoma. Signs and symptoms should be brought to your physician, such as swelling of the lymph node, fever, night sweats, weight loss. Your primary care provider should then screen you for lymphoma. And the same goes for leukemia. Signs such as fatigue, frequent infections, easy bruising. If you're having these signs and symptoms, especially coupled with a family history of these blood cancers, you should bring these concerns to your primary care provider to be screened for these blood cancers. And let's end with education and awareness. We know that there's a disparity with these blood cancers because we simply aren't aware, and therefore we are not educated. And so LLS comes into play with this. Programs such as the Myeloma Link program, which links patients who are diagnosed with myeloma to providers such as myself, who are going to be leading experts in this field that is of ethnicity, such as myself, can give you knowledge about the disease, make you aware, and make you an educated patient. Because I strongly believe that educated patients become healthier patients because they become self advocates. They ask questions, they know their family history, and they advocate for themselves. And what I'm suggesting to you is to do as such. Ask questions, know your family history, and if you're having these signs and symptoms, advocate for yourself to be screened because early detection and screening is the key. It's the key to cancer and also the key to preventing and conquering cancer as well. And so that's my time, folks. I hope you learned something, and I'm here for questions.
That was too much, too good for me to let you off like that. Come on back up here, Dr. Coring. I'm going to pick up some of what you dropped off. And there are four different things that I heard that I want to make sure that we slow down and drill down for the population. It is okay for you to have conversations. It is okay for you. Back in the day, we're talking generations ago, the big C was a thing. It was on everyone's mind. Everyone's afraid of it. Every time anybody lost 5 pounds, had back pain, had a lymph node, they were worried about the big C. What's changed? Nothing has actually changed. It's pretty important that you bring that same level of awareness to the conversation. So the first point that I want to reaffirm for you is that it's okay to have conversations. It's okay to be diligent. It's okay to have reasonable concerns, just not irrational fears. If you have the types of symptoms that Dr. Coring mentioned, it's okay whether you're in an emergency department or with your primary physician to ask, should I be screened? Are these symptoms that potentially are cancer? A point that he made that is just so critical. There is a huge difference qualitatively between being diagnosed on day one and day 6 months later. So let's leave this conversation with a due amount of diligence about asking. Am I correct there, Dr. Coyne? You want to clarify that in any way?
100%, Dr. Sterling, you're correct, and I could not agree more. Instead of thinking of it as the big C, thinking of it as a chronic disease. Right now, we want to treat cancer with the same ideology as diabetes, hypertension, meaning we want to give you the same quality of life, but we have to diagnose it and detect it at its earliest stage. That way, we could afford you the same quality of life by controlling the disease, keeping it under control, and sometimes even cure. We don't have a cure for multiple myeloma. That's the truth. But if we diagnose it early, we can definitely give you a great quality of life and extend your life. So
Okay.
screening is very important.
Okay. So let's stay here before I move on because you mentioned something else that's kind of important here. You mentioned IRP. IRB. People don't know what that means. That's Institutional Review Board. And I just want to start this once again. You can pick it back up. It's pretty important to know that research is actually our friend. It's not a detriment. The existence of an institutional review board is a protective mechanism that arose out of the Tuskegee trials to ensure that the types of abuses that our community is afraid of will never again happen. So going toward research is important because if we are not included in research studies, then the research studies may not be as applicable to us as they might be otherwise. In other words, if all research is being done on white males, that doesn't necessarily have a direct applicability to African American females. So let's not be afraid of IRBs when those are mentioned. Let's not be afraid of research studies because they actually hone in with a degree of specificity toward what may work in our community specific examples. You want to take it from there?
Absolutely, Dr. Sterling. Thank you for bringing this topic up because it's a very important topic that should be discussed in more detail. So I agree. The thing what we have to understand about clinical trials is that one, it's not a death sentence. Just because you're being offered a clinical trial does not mean that you're dying. It simply means that there's been a drug that's being studied that may benefit you. Sometimes it's the last option. Sometimes it could be one of the first options. But you need to understand your qualification for a clinical trial. And just because you're a minority, some physicians, and I apologize for this, may not even offer you the clinical trial because of the perceived implicit bias. And so you have to be an advocate for yourself to ask that physician, do you qualify for a clinical trial? And
Okay.
he or she may look into that, and you can advocate for yourself to see if you yourself qualify for a clinical study. And LLS can help you access those resources to see if you yourself qualify for clinical studies. So that's the second thing. And the third thing with clinical studies, as Dr. Sterling alluded to, is it helps the community. You don't want to take a drug that you're not certain this drug has been studied on your demographics. Uh,
Mhm.
uh, Most of the time, we take drugs that have been studied heavily in Caucasian males, essentially. And so we need to understand how these drugs work on people of our demographics, our community is very important. So you're not only helping yourself, but you're helping the greater good. You're helping your own community. And that's the last thing I would say.
Oh, it's not the last thing you're going to say because I have one more for you. You dropped a big bomb here. People need to know about stem cell therapy because
Mm,
it sounds scary, it sounds futuristic, but once again, it's part of the reason why we have an opportunity to have better outcomes. And if we don't avail ourselves and even know about these types of things, then we will continue to have the types of fates and healthcare disparities that exist. So take just a moment and tell us a little bit about what stem cell therapy is and why it's important.
Absolutely. Thank you, Dr. Sterling, for this opportunity. And I will use this as an opportunity to explain what's maybe going on with a friend of mine. And so, cancer typically affects people of older age. But when we talk about blood cancer, there's a range. It can affect people as young as 4, sometimes even earlier to age 89, 90, even 100. And so it's a broad range. And typically when we talk about cancer, we're thinking about older folks. But when we talk about myeloma specifically, especially in the African American community, it's affecting us at an early age. In fact, 3 times as likely to affect us at age younger than 50 than any other population. And so what we need to understand is part of the treatment modality of multiple myeloma is stem cell transplantation. That's standard of care. The problem, though, Dr. Sterling, is that this therapy mainly is only offered at comprehensive cancer centers. So, unfortunately, people who live in rural environments uh, typically don't have great access to this type of therapy. The average distance to an environment or a cancer center that offers this type of therapy is about 78 miles for a typical individual. So, therefore, it takes diligence, transportation, it takes caregiver, it takes all of these things to be in place to have access to this type of therapy. And so LLS also have resources to help with transportation and access. But to answer your question more directly, stem cell transplant is a therapy that essentially mobilizes your own stem cells that's produced in the bone marrow. These stem cells are basically undifferentiated, they're considered non-cancerous. And so we want to gain access to those cells. And so our goal is to put your cancer in as deep remission as we can. And once we do that, we want to basically gain access to your stem cells because we think those are the healthiest cells in your body at this moment. And so, in order to gain access, we give you medications so your body can produce more of these cells and for these cells to leave your bone marrow to get in your bloodstream. Once we feel like these cells are now in your bloodstream, we collect these cells. And once collecting these cells, we now give you high dose chemotherapy to destroy the cells in your bone marrow and replace those cells we destroy, including those cancer cells that originate in your bone marrow. We now want to destroy them. And once we destroy them, we want to replace them with the stem cells we collected, typically your own stem cells. But there are also stem cell transplants where we collect stem cells from your loved ones and we'll replace the stem cells that we killed with the chemotherapy with the stem cells that we collected from your loved ones. This is curative therapy for a lot of blood cancers. And this is great therapy for multiple myeloma. Not curative, but it's standard of care therapy that's now being used more readily. But we need to know about this therapy and we need to understand how to get access to this therapy. And so if you have a blood cancer, please ask your doctor about stem cell transplantation. And don't let your doctor tell you that you don't qualify if that doctor is not a transplanter himself or herself. Let the transplanter tell you you're not qualified. That's very important.
I really hope everybody is understanding what's being said here. This is why LLS and part of what Brother Jones was saying is so important. You have to make healthcare professionals do their job. You also have to know where the resources such as LLS brings to the table are so that they can help you get to the regional treatment centers. It's critical. Knowing about how to manage a disease doesn't just involve the logistics of it actual treatment. It's knowing how to navigate the system to affect the best possible opportunity to get change. Very important part of this conversation. I hope that you receive that. Thank you so much, Dr. Corin. Fantastic. If you have a heart, it's about to be touched. I really love the message that Brian Daly is about to bring to you because, as both an emergency physician and a public health professional, I'm here to tell you that your outcomes on the back end are in large part related to how you come into the conversation. And that is both in terms of your baseline level of health and your knowledge of how to navigate the system. So with that being said, welcome to a survivor story. We're going to let Brian Daly talk about how he navigated the journey from being diagnosed to survivorship and not just surviving, but thriving and flourishing. So the floor is yours, Brian. Welcome.
Excuse me. Can you hear me? This is Dr. Finch in Texas Zeta Lambda chapter. May I maybe ask a question or make a statement on the back of the multiple myeloma thing?
Yeah, we'll come to you. You'll be
Okay.
my first
Okay.
question
All right. Thank you.
follow up. Thank you. The
Well,
floor is
thank you
yours.
so much, Dr. Sterling. I appreciate that introduction. Rodney and Dr. Coring, outstanding description of some of the nuances around this disease. As Dr. Sterling stated, I am a patient. I also happen to be the National Community Outreach Manager for the Leukemia and Lymphoma Society's Myeloma Link initiative. And I want to thank all of you for participating in this call, particularly because it is Myeloma Awareness Month. I'm going to be brief. I think most of what was already said was very well described in terms of from a clinical perspective as well as from an advocate perspective. So I'm going to focus mainly on my journey as a patient. Now I'll be as brief as I can. A lot of what Dr. Coring was saying in terms of being your own self-advocate, I 100% agree with that. That's key. I was diagnosed back in 2018. I was in my early 50s. I'm currently 60. And actually, no, sorry, I was in my mid 50s. And I was relatively healthy. I would go to the gym maybe 3 or 4 days a week. I was a former athlete. I ran track in college. Never had, or I was not aware of any cancer in my family. So that was something that really came to a surprise. It came as a surprise to me and my family when I received the diagnosis. But the way I received it, and this is to the point of early diagnosis, is and there's several other factors also. I don't want to minimize the other factors that went into my recovery. But as a self-advocate, I knew my body. I go to the doctor religiously every year to get my annual physical. I have a very good relationship with my primary care physician, who was tracking high levels of protein in both my blood and urine. And over a few months, he kept a real close eye on that trend. But it wasn't until maybe 6 months later, after he began that tracking, that I was in the gym playing basketball and I jammed my finger. It wasn't anything that was unusual. I've done it dozens of times in the past, but for some reason this didn't heal properly. Turned out to be a fracture, and I knew that something was wrong because it was just, it wasn't that big of an impact. So that information, I took that information to my PCP. He put two and two together and suggested maybe this is something that's systemic and we need to have a specialist take a look at it. So we made appointments with a hematologist, nephrologist, because I had my kidney function was starting to diminish. We were following some trends in that as well. And so ultimately, I went to an oncologist. We had a biopsy, and it turned out to be myeloma. This is something I've never heard of before. Many people I've spoken to, a lot of patients, I talked to a lot of patients, and most of them confuse myeloma with melanoma. For some reason, that particular cancer is more well known. But once I discovered what it was, my initial thought was, we got to rally the troops. I had friends and family who kind of came together and helped me go to my chemotherapy treatments. And I'm like Rodney, I'm deeply religious. So, my faith was there. Fortunately, I kept myself strong physically, as well as spiritually. And that really helped, having that positive attitude and having family around. Another thing that may be unusual, when all things are lined up, I had great major medical. I had a business that was actually generating income without me being directly involved. So there was no stress there. I also had a cancer policy that my wife and I invested in back in 2007. We bought an Aflac policy, and even in 2008 during the recession, it would have been easy to get rid of it. But we stuck it out, don't know why. Because like I said, neither one of us had a history of cancer in our family. But I'm glad I did, because it's still paying for the medication that if I showed you the statement that I get every month for this medication, it's over $1,000 for a 30-day supply. So I say all that because I'm a poster child, basically. There's a reason why I went through this, and I take that seriously. My first response to coming out of treatment after I had 6 months of chemotherapy and ultimately a bone marrow transplant or a stem cell transplant, they can go synonymously. I had the opportunity to donate back to myself. That's called a autologous bone marrow transplant. That's when you can donate T cells back into your own body, sort of like a reboot. And so typically that procedure has a better outcome than if you were to get, T cells from a donor. So a lot of things were lined up. I was presented with the opportunity to participate in a clinical trial. I turned it down, not for the reasons of, fear from, historical experimental treatment of Blacks in the past, but because I wanted to know what's the standard treatment, help me understand why I should do clinical trial versus something that's been proven to work until that doesn't work, and then we can maybe explore the clinical trial down the road. my physician team went with that. Turns out that my oncologist told me I had uh, a genetic, they call it a geo-specific mutation in my DNA, which was favorable for the treatment that I received. So we went through the chemo, bone marrow transplant, 90 days of being out of the public domain. Fortunately, it was right before COVID, so didn't have to be afraid about going out and getting infected. And after about 6 months, I was dedicated to reaching out to the community and letting folks know that number one, you need to financially prepare yourself for things that you don't expect to happen. And number two, you need to take care of yourself. And we all know that, men were probably less likely to go visit a doctor on a regular basis. And then when you drill down to the men of color, that includes, the Latino community as well as Blacks. We just have this machismo mentality where we feel we're indestructible and we can wait to go see a doctor. And so my goal is to advocate on behalf of uh, those who may not have that information available. So I was exposed to LLS as a patient. My oncologist office had a patient liaison. He gave me a brochure and told me to call, and I called them. I was very impressed with the information they gave me. Told me not to Google anything. Uh, I was very diligent not to take that advice, and found that LLS is the expert in blood cancer. We've got some top-notch talent that's really looking to find a cure for all types of blood cancer. And we have folks on the ground like Rodney who, they're passionate about what they do. It's amazing. It's an amazing organization. So I was presented with the opportunity after volunteering to join as a staff member, and now um, I'm responsible for recruiting partners, Alpha Phi Alpha Fraternity Incorporated being one of our premier partners, um, to do some grassroots collaboration. And it's meaningful. We have a mutual interest in moving the needle and helping to close that disparity gap in our community. And it's amazing. I'm going to let Rodney share with you some of the things that we're doing to close that gap. And once again, I want to appreciate all of you for participating in this call. And we look forward to working together in the future.
Thank you so much, Brian. I'm just going to jump in really quickly. Dr. Sterling, thank you for this platform. Brian, thank you for your story. I just want to say to anybody who has any questions about blood cancers, we are the experts. We have something called the Information Resource Center. That is the Information Resource Center, or we call it the IRC. And that number is 800-955-4572. I believe the technician is going to put it in our chat, but that's 800-955-4572. That is the Information Resource Center. We have expert master level trained sociologists, nurse navigators, individuals who are very, very knowledgeable in the blood cancer space. And then we have a number of resources, financial resources, peer-to-peer support. We've got information on clinical trial support, where we call it the Clinical Trial Support Center. Where there can answer any question you have. Some of the information that Dr. Corey alluded to earlier, they can answer those questions for you. 800-955-4572 is the Information Resource Center number. Thank you, Dr. Sterling.
Fantastic. We have time for one question and one comment. I promised Dr. Finch that I was going to let him jump in with a comment. Sir, the floor is yours.
All right, thank you, sir. No, I'm Mike Finch, Zeta Lambda, Texas, District, Texas, Area 1. So just to Dr. Corey's point, while he's on the treatment part, I'm on the front end and primary care. So a lot of guys that do go to the doctor, the real subtle things are, as he kind of alluded in it's just a high calcium and protein in your urine. Those are things that should not be there. So just if nothing else, at a real grassroots level, a lot of times there are a lot of mid-levels that are helping to provide service now in many aspects of medicine, which is fine. But I would just ask that as you're talking with friends and family, try to get a copy of labs if you can. They're yours. Look at them, and things that are usually in bold, there's something about them, and just kind of follow up on that. But the vignette that he gave with the guy with the back pain, or even the gentleman with the finger that just hurt. So I mean, you'll get there eventually, but there are some basic labs that you're getting with your wellness exam, which includes what we call a Chem 22. It includes a calcium. And then most of the time we are giving urine. And so when we're seeing protein in the urine, that can mean many things. But once you kind of tie the whole story together, you're going to come up with some things that you probably should follow. So I just wanted to put that out there. Just be forthcoming, ask your PCPs to lend you a copy of your labs, look at them. We're not expecting you to know everything, but if you see something that's usually bolded, then try to have that conversation with them, and you might can get to some of these diagnoses earlier, which allows people in the treatment space to be able to be more helpful to you. So, but thank you for just letting me put that out there. I appreciate that. Thanks.
Thank you, brother, Dr. Finch. A general question. I see we have Lyman Lewis out there. He's wanting to know about CAR T therapy programs. Did you want to take that conversation, Dr. Coring?
Yeah, thank you, thank you. And let me just cut on my video. Yeah, thank you for the question. Me and Mr. Lewis have been kind of directly messaging each other, but his question specifically is asking how many African Americans opt into the CAR T therapy programs. And this is a not such an easy direct question, or not essentially my answer is not going to be direct, essentially what I'm trying to say. Because CAR T therapy has an indication not only for multiple myeloma, but also for lymphoma and leukemia. And the disparity is with essentially multiple myeloma. And there are studies now, simply because the CAR T cell therapy is really good therapy. In fact, this is now becoming more preferred therapy. So there are trials trying to essentially see if CAR T therapy should be offered as frontline therapy or standard of care versus the transplantation. And so those studies are ongoing and active. Now, we don't have studies to suggest CAR T cell therapy efficacy as it pertains to African Americans when compared to other populations. We have not done that real world data research yet. So we're not sure if African Americans do better with CAR T cell therapy in regards to other populations. But we do know that when African Americans are being treated equally, as far as being offered the same exact treatment in a timely manner, we do actually better, especially when we talk about multiple myeloma. And so therefore, I'm saying CAR T cell therapy is a therapy being used in the blood cancer space. Now it's second, third line treatment in multiple myeloma, but in some leukemias and some lymphomas, it's being offered in the first line setting. And we don't know if African Americans do better with CAR T versus other populations.
But it's fair to say that being able to avail ourselves of all available options is better. It's better to have access to it and not need it than to need it and not have it, which kind of brings us to what I want you guys to know. I would absolutely be remiss if I didn't double back to Brian Daly's comments. He's the message, folks. And if there's somebody in the audience who's actually looking at him and saying that, wow, he was the perfect storm in terms of being ready to have the best possible outcome, that's exactly the point. We have a responsibility as men, we have a responsibility as patients to be stewards of our own health. We can't think as much about curative care as we do preventive care. An ounce of prevention has always been better than a pound of cure. Stay on the ready. Elevate your life to include considerations about protecting yourself from your death. Okay, please, please, please take the time after this call to find out, the things that you put on your refrigerator door. Know where your local LLS resource center is. Look at the number that's been posted and take advantage of it. It's 800-955-4572. Make that one of the numbers that you care about. In your to-do list, make sure that you plan on having a conversation the next time you see your primary care specialist, generalist. Am I at risk for cancer? What can I do to modify my activity and exercise, my diet and nutrition considerations, modifying my stress? These are important conversations for you to have. Do not wait for disease to appear before you have these conversations, and you'll have a better outcome, much as Brian did. It's really that simple, but implementation of those best practice considerations is something that we tend not to do as well, or because of social determinants of health, we aren't able to do as well. And that's how you get to the healthcare disparities that exist in our communities. I just want to thank everyone here for taking the time, for caring enough to give of your lives and your careers in this way to address this part of what challenges us as a people and as citizens in this country. I want the chapters of Alpha Phi Alpha to be aware that this is part of an ongoing initiative. Your chapter leaders should be prepared. We're going to be sending out meeting requests from LLS to talk about community outreach partnership within your communities. Make this a priority. It's important. Cancer in general, and this specifically, is something that we have to be on guard against, that we have to prepare ourselves for, and be able to access appropriate treatment. Again, on behalf of our general president and the Alpha Phi Alpha Board of Directors and the Leukemia and Lymphoma Society. I got that backwards. My apologies. I'm Dr. Jeffrey Sterling, Surgeon General, and I just want to thank you all for participating. Thank you, and good evening, and God bless.
Thank you, Dr. Sterling.
Thank you, Doctor.
Thank you.
Thanks, everyone.